Well, very early as we started to plan for health care reform, there was an ad about this lady who had come here because she couldn't get care. We found out that was a paid actor, so they took that ad off. Tell me, how could the system be reformed to benefit the small businesses the most?
I think there should be a concentrated effort to create large pools to manage their risk, and so that they can offer affordable rates. Treat all the small businesses in, let's say, a 5-state region like you would treat a General Motors, and offer those businesses across the lines through associations or independently. They can join this group, this pool, to reduce the risk. The insurance companies are supposed to be in the risk business, and they want their cake and eat it too. They don't want to take the risk, but they want the premiums, the high premiums. I think they should be paid well for taking the risk. So let them take the risk, and then let them be paid appropriately.
Well, the provisions that we are debating now in the House and Senate, primarily in the House is what I'm familiar with, are there steps in the direction of giving small businesses more opportunity to afford premiums?
Yeah, there are a lot of ideas floating. National Federation of Independent Business has some ideas and such, but as I told Majority Leader Hoyer, the public option is fine with us. We can ride with that very well, and if there is a public option, I think that would be a blessing.
Well, so do I, and I don't know how we reach the goal of making sure that everyone has access to an insurance coverage premium without that component. Otherwise, we're recycling the same thing that we have. We could put provisions in there that eliminates pre-existing conditions and other, the prohibition of dropping people because they're diagnosed with certain things. That could be fine, but that is all about people who have premiums now. We have to give some concern to people that don't have access to premiums, or we're going to end up closing most of our hospitals. I have in my district a very excellent public hospital, Parkland. It is always in the top 10, even though it was built prior to technology. We're about to get ready to build another one. Now, they had $513 million of uncompensated care in 2007 that continues to go up. That hospital is not going to be able to stay open unless the people going there will have access to some type of insurance. What's happening with that? Property owners are picking up that tab. 89% of the people that are giving birth are people who would not even be eligible for insurance because they're non-citizen. But if they get care, they would have to pay.
Sure.
90% of the people that come to our emergency rooms just coming for sick care because they don't have insurance and they don't have a physician. That must be corrected. And the only way we can correct that is through this health care reform. The citizens are tired of paying for everybody else's health care and theirs, because for every person who is paying a health care premium right now is also paying for 3 or 4 other people expenses in health care, because the insurance company is not going to absorb anybody's expense. And hospitals have to get that money replaced from somewhere. So it goes into our property taxes. That is a major reason we really do need health care reform. So I think that in order to have a nation that's going to come out of bankruptcy and people who can maintain their homes and all that expense, we have got to take that load away from them and make sure that all people have access to buying a premium to cover them. And I've been saying no free care. But the care ought to be based upon what people are able to pay when it's in a public option. And people should have choices. Now, the insurance companies don't want that public option. And they've described it as being this big government plan that will control health care. Actually, it will be for those people that don't have access to coverage anyplace else. If they had access, they'd have it. They don't have it because the insurance companies will not insure them. So that is the reason why we are proposing to have a public option. Frankly, I don't know what we would do without some way to touch that need, whether you call it a public option, whether you call it a network, or whatever. We need to have some reason and some way to make sure that people have access to paying for a health care premium.
Insurance companies have got to face the reality of a real need. There is a real need, and they've got to come to grips with this, and they better face it.
Well, they spent millions and millions and millions to convince people that it should not happen, and they've got people standing on every corner around this hill telling us, you know, don't put a public option. We don't want government-run health care. Well, you know, the government has run Social Security all this time, which means health care for in Medicare. It means Medicaid, that without Social Security and those amendments to it, we wouldn't have that. And Social Security has never had a check to bounce.
That's right.
So I think it's been pretty successful. You start telling people you might mess with their Medicare, and you have a problem. Those are federal programs run by the federal government that have been successful, much more successful than private insurance affordability.
And that's what you're proposing in public option?
Yes.
Yeah, an emulation of that, and I think it would be great.
If the insurance companies would cover the people that need this coverage, then we will have reached our goal. It'll be okay with me if they do it. But they're not doing it, and I don't think they will.
Keep delivering the word. We'll win in the end.
Thank you very much. And thank you for coming.
Well, thank you for having me.
See you next week.
This has been another edition of Report from Washington featuring Congresswoman Eddie Bernice Johnson. You can reach Congresswoman Johnson at 202-225-8885 or 214-922-8885. You can also contact her through her website at http://www.house.gov/ebjohnson.